I feel like I need to declare Michael Scott style. I declare HIPAA because I'm with my doctor, Dr. Shiv Patel. Shiv, thanks so much for sitting down with me.
Thank you for having me.
I am so excited to chat with you for all sorts of reasons, but you heard it correctly. You are my doctor for those
hmm
listening, watching,
hmm
and I've been wanting to talk with you a lot because we have a really cool relationship. You've been a big part of my own fitness journey, and I'm excited to learn more about your own journey.
hmm
So, Shiv, the question I usually start out with everybody
hmm
is where were you born actually? Where'd you grow up?
Philadelphia.
Philly. I didn't
Yeah.
know that.
Yeah.
Okay.
Born in Philly, moved to Atlanta when I was 8, and then kind of had Atlanta raised me from there.
So did you remember as a kid like having like Wawa and like some of the classic Philly
No,
experiences?
no.
No,
Wawa was not a thing.
not a thing at
No.
all.
I think there was like one that you all went to, and now they're on every corner.
Okay.
But no, Wawa was like more of a last 10 years, 15-year type of thing. Yeah.
Gotcha. So do you have any particular memories from that part of your childhood in Philadelphia?
Not too much. Not too much, to be honest. I mean, I went to a Catholic school, and me and my cousins, we all kind of grew up together. So we all went to school together. We all came back together. We all hung out, like neighborhood. Um, that's pretty much it. I was young. I was pretty young when I moved, so more of my memories are from Georgia.
Okay, so let's shift to Atlanta then. So
Okay.
when you moved to Atlanta, you were 8 years old.
Mm-hmm.
What do you really remember about growing up there?
The biggest thing, more land, right? Because Philly is more city. So the biggest thing, just being able to more freedom, being active, different lifestyle, right? South and the north, but the biggest memory is just in the I guess in the sense of what?
More
Which
so just any particular memories of a lot of the people I've talked to grew up in the capital region, and
mhm.
that seems to define a lot of the people and how they view this particular area. But you, like me, did not grow up in the capital region,
Mm-mm. Mhm.
and you especially did not grow up immediately adjacent to the capital region.
Mm-mm.
So more so for like growing up in a place like Atlanta,
Mhm.
what were some of the differences maybe compared to how you might think somebody would have grown up around here?
Just small city vibes. So Metro Atlanta, I grew up in Griffin, Georgia, so very small city. Everyone knows everyone, so I guess that's a little similar to this region. Um, but it was just more like community involvement. You help each other out. A lot of my relatives lived in the area, so that was like a huge factor for me versus, I mean, same in Philly, right? Because I had most of my family, but the biggest thing for me in both places were just growing up around family. That was a huge part of my life and still is.
So what types of family environment did you have? Like, can you talk to me a little about your brothers, sisters? Like, how
Yeah.
many siblings did you have?
I have one
Just
sibling.
one.
Yeah, one
Okay.
older brother, but, all of my cousins were all the same age, just about. We're, like, 2, 3 years off, so if you add all of them, probably 10 to 15 of us all growing up together. So my grandma kinda raised us, while while my parents worked, and so after school, we would all hang out together. We would, do our, homework and activities. So we all grew up very active. Because think about 10, 15 kids just always hanging out together all the time.
Yeah.
So that was a huge thing, a huge factor. So,
Were you pretty active as a kid?
yes,
What did you really enjoy doing?
I was just always hyper. Like, I remember my mom would tell me just quiet for like 5 minutes, please. When we were growing up, my uncle actually, he's like, "I'll pay you $5 if you stay quiet for 1 minute." And it was just I was always on the go. I was just always wanting to do something, always, playing outside. I grew up playing basketball actually.
Oh, I didn't know
Yeah,
that.
yeah. And then I shifted to soccer when I moved to Georgia, and then kinda went from there.
Okay.
Yeah.
So you grew up in Georgia, basketball, soccer player.
Mhm.
So as you proceeded like through school, what made you decide ultimately that you wanted to pursue a career trajectory in medicine?
Helping people and just wanting change. I think that's the big thing. Growing up in ethnic background, um, health and fitness is not a huge part of it or a factor, especially in Indian culture. Now, definitely changes have been made, but back then it's like most of our foods are carbs, and you go for like a brisk walk, but pushing fitness and activity and healthcare isn't like a huge thing in Indian culture. Majority of Indians have diabetes or hypertension, including my parents. So I think just looking at that, I'm like, I want change. I need to be able to help people.
There's often the language of health disparities that are used, and it's interesting you talk about the being Indian and having like the Indian American community kind of culture with food and how that related to you growing up in that culture. So that's interesting because you think about black and brown disparities with health disparities
Mhm.
often, but Indian American is obviously a specific lens that you have.
Mhm.
How did you see that playing out for yourself when you were growing up in Atlanta? Because I think a lot of people think of Atlanta, they think obviously it's one of the largest, densities of certainly Black Americans in the country. But as an
Mhm.
Indian American, did you relate to that at all?
Well, we grew up going to temple. So a lot of the people that we grew up around were also Indian American. Um, I went to a private school in Atlanta, or I guess not in Atlanta, it's in by Macon. So majority of my classmates were Caucasian. Small classroom, 15. We had 15 people in our entire grade. So that's kind of the environment that I grew up in. As got older, switched to public school when I was in high school, and that's when I think the culture change happened for me. And a lot of that, Southern comfort food started to become, part of what what I eat or
Yeah.
ate, I guess, at that time.
How
Yeah.
old were you how old were you when you started to kind of think through some of these things on a bigger level?
To be honest, I think it was more of high school.
Okay.
Yeah, because I was pretty sheltered until then. I mean, switching from a private school in Philly to a private school in Georgia, and then when I went to a public school in high school, I'm like, okay, this is when I started to see more, just more change, more differences, different people, and that's what kind of opened my eyes.
Was that one of those moments where you sort of realized that you wanted to again help people and
Yeah,
had that light bulb went off that medicine was a path for you?
yeah, yeah. And so I knew I wanted to help people. Went to college, went to the University of Georgia, and there was what 350 people in each class. Everyone's pre-med, right? Everyone wants to go into medicine. And that's nerve-wracking. Medical schools are competitive. They are selective. Everyone's has one goal. So in college, I was like, okay, I think I want to go into physical therapy. I want to be a PT. And then my dad, it was my sophomore year, and I don't think this is something that you know, but it was my sophomore year in college, and my dad applied to a Caribbean medical school for me. And they had a program where essentially you finish your undergrad on the island and then have maintain a certain GPA, and then go directly into the medical school program. So after my sophomore year at Georgia, I left and started this school in Antigua. It's called American University of Antigua. So I think I was 19 when I moved.
What was that like being all of a sudden transplanted into the Caribbean?
Yeah, that was wow. Wow. I grew up so fast. Um I didn't know anyone when I went there, and no family around, right? Small island in the Caribbean. It's not like, "Hey mom, I need X, Y, and Z," and they're right there. And being 19, majority of my classmates were a bit older. Um it was scary, very scary. But I think it pushed me in the right direction. It really just made me say, "Okay, this is what I wanna do, and I have to do it," you know? Focused, would go to class, go home, would get tutoring from I remember Orgo 1 and 2 were tough for everyone, and I remember I would always stay late and work one-on-one with my teacher, who was the absolute sweetest. I can't remember her name anymore, but she would help me, and I would do extra homework just to get ahead, and I think that it just pushed me in the right direction. And the biggest thing that my dad, I remember, told me He said, "If you don't like it, come back." And I think that having that security of just like it's not all or nothing and having that support in a way was huge.
So how long were you living there and working there?
3 years.
3 years.
So 1 year of undergrad, so it was like a trimester, so you went through 3 semesters, and then I did 2 years of medical school on the island.
So all in all, what did that experience really give to you?
It A lot, a lot. I think I grew up so quickly in those years, because it taught you not only just medicine, but life lessons, managing money, right? Because again, it's not like mom and dad are 2 steps away. So I would allow my parents to give me allowance for the semester, and this is like what I had to budget. Um, the other thing was seeing that culture down there, you realize how privileged you are in America. Um, it's you know, horses crossing the street and cows, stray dogs. Like that culture is, and healthcare down there is not easily or readily available. I remember when we rotated in the hospitals, you would see kind of like the conditions they were in versus how they are in America, and it's just so different. Most of the people that are severe on the island would actually get flown to Miami because that's like the closest healthcare that they were able to have. So I think it opened my eyes in so many ways, and it made me so grateful for what we have here. But it just made me like it drove me even more to be like, this is what I want to do.
So what was next for you after that very formative experience?
Well, then you have rotations and then you have residency as far as like schooling goes. So I did most of my rotations in Brooklyn, which was also a really cool experience. We were in like Kingsbrook, Kings County area, and a lot of trauma, a lot of psych. So that was really cool experience of just being able to see that.
Let me walk back for a minute because I think a lot of people who are not used to the language of medicine, they really
hmm
don't understand this process of sort of going through college and medical school and how you get placed in residency. So how did you end up in Brooklyn?
So rotations are part of your second 2 years of medical school. So you do 2 years of clinicals and then 2 years of rotations. So I guess those are technically clinicals, and they are usually linked with your medical school. So that's how I ended up in Brooklyn.
Gotcha. Can you talk a little bit more about your medical school experience as a whole?
In which way?
Just sort of like just generally where you went and kind of how it all started and unfolded for you beyond the experience and time you had in the Caribbean.
Yeah, well, that's where I went to medical school.
Oh, okay, my
Yeah,
bad. I thought there was that was like one particular piece. My bad. So that was really the full experience, and then
yeah,
you ended up being placed in Brooklyn.
yes.
Gotcha.
Yes, so the Caribbean, so the way the programming works is for Caribbean schools.
Yeah, see, this is why I asked because
Yes,
I'm generally confused sometimes when I know doctor friends of mine who I'm like, how did you end up here?
yeah, yeah,
Yeah,
okay. So it is a little bit different. Like if you went to Albany Med, or I think it's U Albany. You go through their medical program, and then residency is the same for everyone. So for my school in particular, how medical school worked is you're on the island for like your schooling part, which was 2 years, and then your rotations are in the states because
got it.
they're accredited in the United States. So you do all your rotations here.
Okay, thank
Yeah,
you for helping me understand that
yeah,
better, which is why I asked,
yeah.
because I think it's so fascinating for like my cousin is a doctor
hmm
and just her journey where she ended up going just always fascinated me. And I'm always intrigued by how doctors ended up in certain places.
Yeah,
So
yeah.
you spend time in Brooklyn.
hmm
Now, the piece that I sort of, in my mind, my beginning of where I know you ended up, at least in part, was Kingston, New York. So
Yes.
how did you end up in Kingston?
So there was a program that did family medicine for rotations, and I was like, I have to go there. I just have to. So I was able to wiggle my schedule, and this was when I was still in medical school. So I did a rotation in um, Kingston Hospital, and it was my family medicine rotation, and I loved it. It was unopposed. I learned so much. So when it came time to apply for residency, so residency is something that you have to apply for. And each program, depending on specialty, has a certain amount of spots. So I applied, obviously, family medicine, ended up getting residency in Kingston, and that's how I ended up in Kingston.
What appealed to you so much about family medicine specifically?
I love that you can treat anyone and everyone. I can treat any age. I can treat pregnant patients. I can do surgery. I can do it all. And that's what medicine was back in the day, is your doctor did it all. And it wasn't like, okay, well, now you have to go to this specialty and this specialty. That, as time went on, specialties were made. But I love that jack of all trades, you know?
Yeah.
I love that part of it.
So now we get to a fun topic, which I've been holding on. So Shiv and I have something in common. Well, we have a lot of things in common, but the way that we really met
Mhm.
was through Power 518 and
Mhm.
specifically through Guy.
Mhm.
So Guy was my personal trainer when
Mhm.
I first started there. I worked
Mhm.
with him one on one. Uh, he is your significant other.
Mhm.
And so I wanted to ask you how you two actually met and get your side of the story.
We met at the gym, and I remember he kept coming up to me, and so Kingston is a small community.
I used to live there. It
Oh, yeah,
certainly
okay,
is.
yeah,
Yeah,
okay.
yeah.
So, everyone goes to 1 or 2 gyms, right? Like, it's not you don't have 5, 6 gyms to choose from,
Did you go to
so
Mac?
I
Was
did
that
go
the
to
gym?
Mac, yeah,
Okay.
yeah. So, we would both end up there around the same time. I had lived there for 2 years before even, like, this happened. So I was in my last year of residency, and he came up to me, like, he would say hi every day, not thinking anything of it, and then he'd be like, "Oh, like, I really wanna get out of here and go grab a beer." And I'm like, no, it's a Thursday. Like, I'm not doing that. And I was just like, "No." And then one day I was like, "Okay." We would end up, like, working out together. Like, "Okay, hey, I'm gonna make a workout. Um, like, let's do it. You make a workout one day, we'll do upper body, lower body." We would split it. And then one day I was like, "You know what? Like, let's just plan something. Like, hey, Thursday, we'll go here after work or after workout." So that way, because I'm not I don't do things on the fly. Like, I need to have a plan. So, we ended up, hanging out. It was during COVID, so it was hilarious. So, we went to, Frankie Guido's. I don't know if
Oh,
you
yeah,
know.
Little
Yeah, little
Italy? Yeah,
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 yeah, right off
exactly.
Broadway.
Yeah.
Yeah.
So, we're, like, walking in during COVID, everything closed at 8, and she's like, "Sorry, we're closed." And I was like, "Yes, I'm off the hook." And then he's like, "No, no, I know another place. There's Stella's downtown. Let's go there." So we go there, and they're like, "Oh, you can't grab a drink if you don't have food, and we just closed the kitchen, but we'll bring out a basket of bread for you." And so we ended up talking until they closed, which was like 10 p.m., and kind of went from there.
Okay.
Yeah.
Now, he and I would compare notes about different things. He'd always ask me, he would see me with somebody on Instagram. He'd be like, "Oh, are you guys dating or
Mhm.
whatnot?" I'd be like, "No, we're, just," but occasionally, you would come up because at the time I
Mhm.
didn't have a doctor. I had
Mhm.
just moved back. And so
Mhm.
he happened to mention that you were a doctor. And I was like, "Oh, that's cool."
Mhm.
But at one point, and I hope God doesn't get mad at me for saying this,
Oh gosh.
my recollection was he had said basically to me that when at some point in time, maybe it was when you first sort of were dating, you guys didn't necessarily like each other at
Oh no,
first.
yeah. No. We were like complete opposite personalities.
Okay.
Yeah, he's very like on the go, and I'm like, I need to have a whole schedule of what my day looks like.
Yeah.
And we are personalities. I was just like, he is so high energy, like this. No. And this was like in the beginning stages. And then, the biggest thing was became friends first before the romantic part even came. And that was like a very new thing for me. So we didn't like each other at first, and then, like, as we hung out, we talked, I was like, "Oh, like, he's pretty cool." And then I guess, like, the feelings kinda came after.
Yeah. Well, it's funny you say that because you just said earlier that you were this hyperactive kid always wanting to
I
move.
know, I know.
So why all of a sudden now were you like put off by him being like that kind of same energy?
You've met Guy before.
I have that guy,
Yeah.
but like I'm just curious because like was
Yeah.
that like a shift in your life where you just that was just like too was it just too much for you to handle initially?
I was in a different I mean, I was in residency, right? So,
Okay.
like, my stress level is a lot higher
Yeah.
at that point. And as a kid, yeah, I was, super hyperactive, like, always wanted to move around, always wanted to do stuff. Even now, like, for the most part, I'm always on the go. Um, but it was just a different type of high energy, like,
Yeah.
and I think the place that I was at in my life at that time, right?
Yeah.
Like just high stress. Residency is not a joke,
Yeah.
especially when you're doing 24s, you have long days. So I
Yeah.
think that's like what it was in that moment.
Yeah.
Yeah.
And I know he's crushing it at Best Fitness, and I'm so
Mhm.
happy for him.
Mhm.
And shout out to Best because they really do such a great job working with their coaches and
Yeah.
trainers, and I'm excited for him there to see what he does in terms of contributing to the community. But I know you've been coached up by him both there and in other settings.
Mhm.
What's it like actually being coached up by your boyfriend?
Yeah. um he pushes me a lot harder than I would ever push myself. And he knows I'm competitive. So when we actually were in Kingston, when we would work out together all the time, um, it's just that limit that I set for myself just got pushed up so much more. And that was like the cool thing about it. Now we don't, our schedules are so different that we don't really work out together anymore. Or we don't, he doesn't give me that coaching or that one on one. But when I did do that training with him, even at Power, he would train Erin, which is, I don't remember if you know her, but I would pop in on sessions with them, and the level that push is just crazy,
Oh
you
yeah,
know?
he's. I mean, I'm forever grateful to him, like,
Mhm.
and like just the time we've
Mhm.
had together, both in those one-on-one sessions and in the group settings, and
Mhm.
his heart just gets set on fire to help
Mhm.
people with it. But I'm curious, you obviously are a doctor.
Mhm.
He's a fitness trainer,
Mhm.
coach.
Mhm.
How do you avoid treating each other clinically in terms of how you talk about your own fitness goals?
I will say when we're in the gym or at the gym, we are not in a relationship, it feels like. It's like this is same thing like if he comes to to the office, we're in our roles. So I think that is a huge factor, especially as I became a doctor and as he's settled into his role as a fitness coach, is in the gym, I'm your coach, you know? And in the office, I'm your doctor. So I think that's a huge factor of it is setting those boundaries.
Do you two talk with each other about each other's kind of fitness and wellness goals as a couple?
Yes, yeah.
How do those conversations go?
More of me saying I want to lift heavier. I want to tone up. Same thing for him. I think with him having all of the things that he does. He works at Best. He's also at Regeneron. He also does one-on-one. So he has 12, 13-hour days a lot of the time. And I know a big factor for him is finding the time and finding the energy to lift and be consistent. That's the biggest thing for both of us is consistency. You know, for me, I do work out typically 5, 6 days a week. For him, he kind of tries to throw it in where he can, especially now. So that is a huge factor that we talk about is okay, we actually did this thing on the calendar every day that we work, like we got a workout in, we would check it off on our calendar just to kind of hold each other accountable.
I know a lot of couples struggle with communicating openly and honestly about each other's fitness and wellness goals, whether they work out consistently
Hmm.
or whether you have one partner who wishes the other would take their fitness or wellness more seriously.
Hmm.
As a doctor,
Hmm.
as somebody who works out regularly, do you have any just practical advice for people of how to approach those tough conversations?
You know, something that has worked for us, it has to be a goal within the household, you know, and not just as fitness, but even things like smoking, drinking, it has to be a goal within your household because if one person is doing eating Oreos or eating chips all the time, And if your fitness goals are, hey, I want to be healthier, I want to, I want to cut X, Y, and Z out, it's hard to do that when things are in the household. That's a huge thing that I always preach in my practice too is do it together. Um, and your partner should be your kind of like your best friend. And that's like a big thing that I think for what worked for Guy and I is we are best friends. And so we have such an open relationship with fitness goals um, that he will straight up say, "Hun, uh, maybe we should get back on our diet," especially like during the summer when I had a season where I wasn't working yet and I started my job. So I think being open and knowing that that person is coming from a loving, place. They're not just saying it to make you feel bad about yourself or be cruel. Because health and fitness is a joint effort. Sometimes it's hard to just push yourself. Like there's a lot of days where I'm like, oh, I really don't want to go to the gym today because I had a long day, but it's just that saying like, "You got this. Great job getting there." I hear that a lot. And then once you're there, it's just like you get your workout done, you leave, and you're like, "I'm glad I did that." So I think that's a huge factor of it.
Yeah, I know a lot of people have really hard times even just trusting their doctor at times or feeling like they have a real relationship because these days you're barely in there
Mhm.
for any real amount of time.
Yeah.
So when you have patients come in, I
Mhm.
mean, we can talk about our experience.
Mhm.
What is your approach to actually working with your patients in that moment that you have them in that room,
Mhm.
whether it's a 6-month physical, annual
Yeah.
visit? What's your mindset going into those conversations?
I talk to my patients like how I would talk to my friends a lot of the times. Um, when I go into the room, just kind of starting the conversation, especially for physicals, let's say. What are you doing for, your diet? How's your diet? And that is a huge, a lot of people say, not so great. Okay, well, what does it look like? Tell me about your meals. What are you eating? Are you eating out? Are you eating at home? Um, are you working out? A lot of people I've noticed it's one or the other, not a combination, right? Some of my patients eat very, really healthy, eat well, but no activity and working a desk job or working at an office where you're getting maybe a few thousand steps in is not enough. It's really a combination of both. So that's kind of how I start out, and then we talk about it. And I talk about my experience and what I do, and things that could help them. Hey, maybe after work, instead of going home, just go straight to the gym, get your 45 minutes in, and then go home, cook dinner, do what you have to do, lunch break, maybe get a quick workout in there because a lot of jobs now, a lot of workplaces have gyms within their facilities, which is a really cool thing. So, and a lot of the times, we can make excuses. We can say, like, I have this, but you can always make time for the things that are important to you. So I talk to them just in that manner of what is a goal that the next time you come in, what is the goal you're setting for yourself that when we come back 3 months, 6 months, that you say, hey, I did this.
Yeah.
And mhm,
Yeah. I mean, I was going to ask, I mean, talk about the mindset and the relationship that people have to fitness and nutrition. And we've had some conversations just about how culturally in the capital region is just so not the same compared to certain cities that
yeah.
just objectively are just more active,
Hmm.
whether it be like in Austin, Texas or in Atlanta, Georgia.
Hmm.
What's your take on just the culture itself of fitness and wellness within the capital region as somebody who's lived here now for a while, but
Yeah.
also obviously grew up in the South?
I In the capital region, I think that you have to make the effort. Right? Everything is pretty spread out. I mean, you have the trails, you have um and New York State has done a great job of making things accessible for people. But I've noticed in other cities like Charlotte, when I went to go visit Charlotte, that's like the big thing. Even in Atlanta, you have the Beltline, and the Beltline is put right through where all the young people typically go. The bars, the food scene, everything is in one area, so you can get your activity in, and a lot of the things are accessible on that trail for you. In the capital region, everything is so spread out. There's so many different communities. So even traveling from Troy to Albany to um, Schenectady, everything is just kind of spread out and everyone's just kind of doing their own thing versus doing it together.
Yeah, I noticed that so much, and even within gyms that market so independently, and all these different wellness professionals I've gotten to know who
Mhm.
market independently.
Mhm.
And what's been cool about my journey is I've gotten to know so many different people who do different things. And in
Mhm.
my own way, I try to be a resource for people in that sense. Uh, but going back to your visits, a lot of that information for a lot of people can be very overwhelming
Mhm.
all at once. On your own journey, like
Mhm.
how have you approached setting sustainable goals when you have your own visits at the
Mhm.
doctor and you're feeling like, okay, I need to work on this, this, or this?
Mhm. Short-term and long-term goals, right? Nothing is going to be done overnight. And I think that is a something that you need to understand for yourself and that I understand for myself. Like, what's my goal for the next month? What's my goal for the next year? Like I mentioned, I grew up active. So going to the gym for me wasn't a huge struggle. I've always gone to the gym. I've always or played a sport. Um, but consistency is key. If you do it here and there, if you do it once a week, you're going to fall out of the rhythm of it. And that goes for anything. So I think that's a huge thing for me is schedule. Like that's a huge goal that I've always set for myself. And I move around a lot and I have moved around a lot. And once I find my rhythm and once I find my schedule, that's like the one thing that I've always told myself, like, okay, where am I gonna go? Where and when am I gonna factor the gym in? I'm not a 5 a.m. gym girl. I don't know if I ever will be, but I know for me, right after work, I go straight there, and that's what works for me. So I think that's what I tell my patients. Let's look at your day. Where can we fit it in? And again, what's the goal for today? I'm not saying you have to lose 50 pounds by the next time I see you. Like, that's not realistic. So, setting realistic goals. Um, and I take as much time as I need to with my patients. It's not, hey, 15 minutes are up, I'm out the door, because that's not going to make you feel secure. That's not going to make you feel like I'm even listening to you. So, I do try to obviously move it along because I don't have 3 hours per patient, unfortunately. But taking that time and saying, okay, how can we work on this together? Right? Because it is a group effort. It's not only you doing this.
What's it like for you when you have conversations that you know need to be had with certain patients and either the information you're working to convey is just tough?
Mm-hmm.
Like, for example, I think of alcohol
Mm-hmm.
with a lot of people, and alcohol, increasingly, there's more and more studies on it that suggest the negative effects of it for a lot of people. It seems like a very polarizing topic within fitness.
Mm-hmm.
What's your take on kind of the tougher conversations that you have to have with people about their fitness or wellness?
Hmm. I try to figure out what the root issue is, right? Why, let's say for health and fitness, some of my patients, well, I eat out majority of my meals. Why? Why are you having that restriction? Is it because you don't know how to cook? Is it because it's a time constraint? Because there's so many resources out there these days, meal plans, meal subscriptions that they literally make the meals for you, and they're cheaper. So trying to figure out what the root cause is, because if we just put a band-aid over and say, hey, you can't do X, Y, and Z, the patient's not going to listen. Same thing for alcohol. I have some patients I drink every single day. Why? What's the reasoning? Is it stress? Is it that you just enjoy it? Why are you doing the things that you're doing? Because we can change that if we know what the reasoning behind is.
Yeah, I mean, I appreciate your approach as you're laying it out because there's just a lot of people that I feel like increasingly have this very anti-medical bias or perspective or feeling, and this language of what is healthcare versus sick care gets thrown around.
Mm-hmm.
And just curious for your take on it. What do you think the medical community is getting right, and how can the medical community be doing better?
Okay. So for family medicine, our job as a primary care physician is preventative care, right? We are we are supposed to tackle the issues before they get to the point where they're not treatable or now we're working backwards. So I think pushing screenings, working, a lot of the physicals are focused on diet, exercise, habits. I think that is something that the medical community is doing right because um, we're starting at a younger age and then kind of following it through. So I see people of all ages, cradle to grave is what I say. And I see families. And I think that is a huge factor of it because I can see mom, dad, siblings, and figure out as a family what the issue is or how can I help everyone versus just seeing one patient saying, okay, well, you have to deal with the rest on your own. But I think the screening factor is huge and just being able to tackle a lot of these issues at a younger age, um, versus waiting. Because a lot of people think that, hey, I don't need a doctor until I'm like 50, 60, or there's an issue. We don't want to treat after the fact. We want to treat prior. So I think that's definitely something that, and majority of insurance companies or hospitals, if you do go there, who's your primary care physician? And they're pushing that a little bit more, which is a good thing because that way you have a doctor, right? You have someone that you can go to, instead of saying, no, I'm fine, and then waiting until it progressively worsens.
Yeah. And you've talked a lot with me, both in this conversation and in other conversations, about kind of your more, in my mind, holistic approach to wellness screenings and kind of the approach that you have to the intent behind a lot of your questions to get at the root of why are you choosing to do certain things,
Mm-hmm.
which lends me to ask about mental health.
Mm-hmm.
As you're working with patients and you start to sense that there are bigger issues at play with some of their healthcare decisions, and I want to be careful because mental health often gets separated, and I think unfairly,
Mm-hmm.
from healthcare. How do you approach your, I guess, scope of practice as a primary care practitioner, well, with that lens of thinking about mental health in your conversations with patients?
The choice of words and the delivery, I think, is key. Especially for patients who are anxious or depressed. You don't want them to feel like you're coming at them and finding their faults and pointing out the wrongs. I've had a lot of patients that came to me and say, "Oh, the first thing that the doctor pointed out, I'm obese," and that was the whole visit. It's a sensitive topic, right? So and I think the rise of mental health awareness, you have to be cognizant of that. You have to be aware that people have feelings, and just because I'm in a doctor role, that I could just neglect that and say, "Oh, well, no, this needs to be said." So I try to take a very soft approach, see how the patient responds, let them do a lot of the talking of, okay, like this is what's been going on, this is how I'm feeling, and then kind of building off of that.
Have you had any memorable experiences or conversations from some of your tougher moments with
Hmm.
patients, or breakthrough moments that you felt proud of after the fact?
As far as like just like food and
Just tougher conversations, maybe going into a conversation or in the moment when you're with a patient,
hmm
approaching something that on the surface may feel like it was a really tough moment
hmm
to confront. Maybe it was,
hmm
maybe it felt like confronting them or carefrontation,
hmm
but ultimately you felt like you were able to have a breakthrough with somebody.
yeah, I've had a few patients that I was trying to let see how I can put this. um I think my approach, I guess, of how to mm, trying to think of how to put this. I've had a few patients that I think have the part that made it tough was they already came in with a certain decision in their mind, right? Like this is how the visit is going to go. And or this is what we're going to do, what we're going to talk about. And those patients are tough. right? Because their mind is already locked in a certain way of thinking and a certain um and I don't want to give too many details, but I remember I had a patient that is transgender and very tough. Like came in, like this just, this is what we're doing. This is how this is going to go. And after the first few visits, and that's again why I love primary care because it's not one and done. I can see you once a month. I can see you once every 2 weeks. And that way we're building a relationship. And I remember I had that patient turn to me and say, thank you. You care. I can see that you care. And just having that moment with that patient was just such a prideful moment. Like it just makes you like this is why I'm doing what I'm doing. And there are a lot of I mean, I can't think of any tough conversations, but I have them daily, you know.
Well, how do you approach somebody if you're having like a Dr. House-like moment where you just are absolutely convinced that that patient is lying to you
Mhm.
about something that you have a medical responsibility, your Hippocratic oath takes over you,
Yeah.
and you're like, this person is so full of it, and I got to be able to like
Yeah.
push back a little bit.
Well, their reasoning. I try to understand why are you saying what you're saying? Right? Where did you get it from? Dr. Google, 9 times out of 10, is telling X, Y, and Z or AI these days. So I try to really just listen to the patient of where is this information coming from and why do you feel the way you do? And then trying to say, okay, then kind of come in with the evidence-based medicine and try to say, okay, well, what about thinking about it this way? And I think and having the patient hearing them out and having them have that moment to say, okay, this is what I want to say, instead of having, again, someone just talk at them and say, this is what we're doing. The number one thing patients always complain of is, I feel like I'm not being heard. And that's why people do either, hop PCPs or hop doctors. I want to be heard. I want to feel understood. And I think that's like the biggest thing is tell me how you feel. Tell me what's going on with you. And then we'll go from there.
Yeah. I mean, there's so many great television shows that show that relationship between a doctor and a patient from an entertaining perspective.
Mm-hmm.
And I always get asked, being in politics, what political shows are more realistic to what political life is like. So I wanted to ask you the same question.
Ooh,
What
okay.
medical shows really get it right, or which
Okay.
ones are just totally off base?
House is off base.
House is off
Yeah.
base.
Like some of those diagnoses, you're like, I have never seen that before. It's just so far-fetched. Um, Grey's Anatomy is a little off base too. Like it's just more drama. I'm trying to think of one.
So you've never met a McDreamy or a McSteamy?
No.
No.
No. They're usually, you know, not in that age group.
What about
um,
Scrubs? Because that's my favorite medical
I
show.
haven't seen Scrubs. I
Really? I feel like
haven't.
you'd get a huge kick out of it. It's
Yeah.
definitely like silly, kind of off the wall comedy
Yeah.
mostly.
Oh, I might have watched a few episodes actually.
Yeah.
There was one show that I really enjoyed. Oh my gosh, The Good Doctor.
The Good Doctor.
Have you
Okay.
seen that?
Yeah.
It's a good show.
Yeah.
I mean, medically still like things are just so far-fetched. I think there's the new show called Pulse on Netflix that I've started watching. But a lot of it is based off of like the trauma and not the medical aspect of things. And it's the rare conditions, right? You're not seeing the elephant or the zebra. Like that's what we usually say. We're not seeing the zebra every single day. Yes, you have those rare moments where you do need to think outside the box but for majority of the part, like that's not what you're seeing day to day. And that's what a lot of these drama, focused shows kind of portray because it's good for TV, right? You know, you want to know those things. So,
Yeah, ER was a show in my house growing up because
mm-hmm.
my dad actually taught Noah Wiley on ER how to
Oh,
play poker.
wow.
The Wiley family are family friends of mine.
Yeah.
I grew up, well, not really grew up, but spent a few years when I was living in Los Angeles because I was born in Hollywood,
Mm-hmm.
being raised in part by Noah's dad and stepmom. And shout out to the Wiley family.
Oh.
But going back to modern medicine and
Mm-hmm.
not TV, but real life, when you think about healthcare as a whole, modern medicine,
Mm-hmm.
what are your hopes for it in terms of how you can contribute to the future of it?
I want us to go back to treating patients. That's what I went to medical school for, right? I know I'm a newer generation doctor, and I'm sure a lot of the older doctors can kind of attest to this is, we went to medical school to help people, to change people. And a lot of what is driven now in healthcare and why people are shying away from healthcare, including doctors and patients, is it's insurance company driven in the sense of, okay, these are check boxes. I'm not saying those things are not important because they are, and it helps us not miss things. And again, back to like screenings and catching things early. But I want to go back to, or I want healthcare to go back to patients feeling comfortable of coming to the doctor when they need to, um, and not waiting and waiting and waiting. Even wait times. I think there's just so many factors that have changed medicine over the years that I feel like more and more people are shying away from wanting to go. And I just want people to trust us again and have and respect. Um, Google, yes. AI, yes, I get it. If you want to look up X, Y, and Z, but remember, those are rare cases. Just because you have a cough doesn't mean you have cancer. And listening to the professionals, I always going back to tough conversations. Sometimes have these little arguments with patients because they think they know more than I do, and it's like, and sometimes you can't change their mind, but all I can do is educate them. That is my purpose, is education. This is how to prevent things, and these are the facts. And at the end of the day, it's up to you as a patient if you want to change your life, if you want to apply those things, and if you want to listen.
So when you think about your medical school life in the
Mhm.
Caribbean, and then that taking you to Brooklyn,
Mhm.
upstate New York
Mhm.
eventually, I feel like there's such a stereotype. Maybe it's just my stereotype or certain stereotypes that exist that the same way that there's this pressure on people who go to law school to make as much money as possible so they can get rid of their law school debt.
Mhm.
That same pressure I think exists for a lot of doctors. So along the way, it seems like you've stuck to and held on to this concept of wanting to be family focused ever
Mhm.
since you were in high school.
Mhm.
What's helped you keep that within all the pressures of the realities of the cost of medical school and everything else? How have you been able to hold on to that for yourself?
Those patients that, and it might be once in a blue moon, but those patients that really say, "Thank you, you changed my life." And every time I have that moment, like, I'll run home to Guy and be like, "Oh my gosh, like, I had a patient that, just said thank you." It's, like, such a simple, word, but knowing that I was able to help change your life, like, I think that is just a huge factor, a huge that make that it really makes the tough days worth it, because medicine is long hours. It's hard work. It's not just seeing patients in and out. You have to do notes, you have to do results, you have to do phone calls, you have to be on all the time. Just because I'm a doctor at work doesn't mean it stops when I'm not at work. Your brain is always going. Um, but just that moment where you've helped someone, and I'm sure all doctors can say we went into medicine not for money. I remember when I was in rotations, one of the attendings asked each one of us, "Why'd you go into medicine?" And I remember one person saying, "Money." He's like, "This is not for you. Medicine is not about money. It's about caring and helping and making a difference. That's what medicine is about." And if that is why you went into medicine, everything else is just a part of it. It's just a perk.
Yeah. And that's a cool thing you and Guy certainly have in common. Like you both love helping people.
Mhm.
And I know he gets fired up with
Yeah.
a lot of his one-on-one clients and different ways that he can feel like he's contributed to their success.
Yeah.
So as you think about some of your own personal goals now, what are some of your fitness goals look like for yourself at this moment?
Um, I wanna get back to lifting heavier. I think, coming to the capital region, I used to going when I went to the Mac, it was creating my own workouts, um, being able to lift a little bit heavier as far as squats and things like that. My goal is to kind of get back into that, creating workouts for myself. I still do a lot of class-based workouts now, which is easier, especially when you have a busy schedule and you're always on the go. It's nice to be able to get into the gym and say, okay, for an hour, I don't have to think, like I just do. But I want to get back into being able to lift on, my Thursdays or twice a week, just to focus on that. And Pilates is another thing that I'm starting to dabble in a little bit. Just strengthening, stretching, recovery is a huge part of it. Like, I know we've talked about that before. Um, I actually just went to a Pilates class before I came. So just being able to incorporate other types of workouts and into my fitness goals is cool because I've always done strength and hit
Yeah, where'd you go to do Pilates?
best fitness.
Best Fitness?
Yeah.
Yeah. Best Fitness does do Pilates, and I
Yeah.
actually tell people this all the time.
Yeah.
Like, they offer a lot of stuff, hot
Yeah.
yoga, Pilates, spin, and, were you at the Schenectady studio or the Albany studio?
Albany,
Albany.
Carol, she makes you
Yeah.
feel so relaxed. And the thing is that, what I do like about Best is that everything is like in one area versus having multiple gym memberships. I know that obviously becomes
Yeah.
really tough. Like like what I love to go to a Pilates studio and have like do the reformer. Yes, but doing that with going to the gym on a weekly basis is going to be tough fitting that in.
Yeah, I
2 3 times
remember
a
when I
week.
was doing a lot more content with them, talking with Eric and Taylor, we'd always talk about how can we tell a story about positioning kind of the value of best fitness and not have it be seen as cheap. Because
Mhm.
sometimes people hear that word value
Mhm.
and they want to think of it, oh, as cheap.
Mhm.
And I often thought, like, I started my fitness journey in part at the Planet Fitness in
Mhm.
Kingston, New York.
Yeah.
And I would often think, like, if I had a place like Best at that time,
Mhm.
wow, I mean, what could have been even faster?
Mhm.
Because even at that price point too, because like for
Yeah.
most people who are thinking about their health or fitness, unfortunately, I think they think, and I'm sure you have this conversation with patients, oh, like how cheap is it? How can
Mhm.
I afford
Yes. Yep.
this? Rather than thinking about investing in their health as
Mhm.
an investment.
Mhm.
It's not just an expense.
Mhm.
But that's cool. You've been able to take advantage of that.
Yeah.
Have you done any like the spin classes or anything like that
Not
there too?
yet. Not
No,
yet.
no.
Yeah. I've only done the Pilates class and yeah, like Be Fit and
Yeah,
yeah.
yeah. No, BFit's cool too. I loved Pilates. I did a lot of it at the Pilates Principle as well, and
Mhm.
shout out to Nahar who runs that studio. But I just love it for core.
Yeah. Yeah.
And I mean, I love Metabolic and Hot Yoga Spot now, but I always think like a lot of people who do yoga miss out on the strength training
Yeah.
pieces, even though you can do some dynamic strength work in
Mhm.
Pilates and
Oh
yoga.
yeah. Oh yeah.
But I'm all about strengthen and lengthen.
Yeah.
That's my
Eh,
mindset now.
Yep. And
Yeah,
it's a combination, it's not
yeah,
one versus the other. And I do like having my days where I'm going and lifting heavy.
yeah.
And then on the other aspect, like I just want to, you know, stretch and I want to um strengthen my core because a lot of lifting comes from your core.
Let me ask you, you talked about wanting to lift heavier, and I'm sure you talk to tons of women, both patients and friends and non-patients about that idea that they don't want to look too bulky.
Mhm.
I can think of fitness coaches I know that have
Mhm.
had people ridicule them for in their minds thinking they're looking too manly.
Mhm.
And I'm of the mindset that strong is the new skinny.
Mhm.
But it's just different for the psychology of women, I know.
Yes,
So, like, as
yeah.
a woman, obviously, who's thinking about wanting to lift heavier, how do you approach these conversations with both female patients and just women in general?
Yeah. I think the huge misconception is that if you lift heavier, you're going to look bulkier. But in reality, you're toning. It's all about proportions too, right? So if your arms are more toned and your legs are more toned, your waist is going to look skinnier, right? Because you've built this kind of like an hourglass shape. And I think women, they're scared at first. And I'm not saying everyone needs to go lift, you know, 100 pounds over their head all the time. It's your goal of what you want to do, but not being afraid to kind of push yourself to be like, okay, I did 15 last week, let me do 20. Because once you start to see the results from lifting, um, and the toning that comes with it, and the independence that comes with it, like I bring all my groceries in on one go. I'm not going back and forth, you know? I think it just starts to be, it's almost like addicting, you know? So I think that's like a huge part of it. It's like short-term goals, right? Hey, I did 20 last week. I'm going to do 25 today. And if you fail, who cares? Go back down.
So I guess what's your take on and this is just my theory because I there are often men who will say just stupid stuff that make women feel like crap in a gym environment or feel like they're being objectified. But unfortunately, from my experience, I feel like a lot of the criticism and frustration that women who lift heavier get is actually from other women. Do you find that to be true at all from any of your experience?
You know, from the Mac is when I really started to focus on my lifting. And no, I feel like women encouraged other women.
Well, that's good.
Yeah.
That's good.
Yeah.
I've heard stories of the opposite, and it always just it's sad. It saddens me because I think that we're in this moment where there there can be and there should be this major cultural shift.
Mhm.
And as somebody who works with a lot of women in politics, there's great community organizations and groups that are often encouraging more women to run for office, more women to think, yeah, don't just run to be a legislator, be an executive.
Mhm. Yeah.
Because I think one of the biggest things holding back the idea of a woman president is we don't have a lot of women as governors.
Mhm.
We need more of that.
Mhm.
So I think the same needs to be true in the fitness industry.
Mhm.
And obviously, like I'm a man about it, so I don't want to try to mandate or like I
Mhm.
just want to do my best to be an ally and a supporter. So have you ever been in an environment or a setting where you're like kind of dealing with somebody who's just like kind of wrestling through that and you have to be the one sort of encouraging them to kind of stand fast to their strength goals?
You know, when I don't know if they were battling that in their head, but I know every time I work out, I usually the people that are around me, I'm like, "Go heavier. You got this," encouraging them. The same thing at, even when we were at Power.
Yeah.
Um, and that's the huge thing that guy will always, "Okay, hey, use this next time." He'll encourage his patient or his clients, not his patients, or even just people in that group setting of like, "You can go heavier." I think some people just need that reassurance, like you can do this. And so I have never really, maybe I ignore it. I'm usually like kind of locked in when I'm at the gym. I'm doing my own thing, but I've definitely tried to push the people that I go to the gym with, like, girl, you can do 25, like you got this. And sometimes they lift and they're like, no, I can't. Okay, go back to 20. But I think sometimes you just need someone else to say, hey, you can do it.
Well, you've probably, I think, said it. It's a lot about the community
Yeah.
and what environment are you in that's going to push you to do more than you think you're capable of.
Yeah.
Whether it's a good coach who's
Mhm.
encouraging you, who's motivating you, who's getting you to unlock you to a new, who's getting you to unlock yourself to another level
Mhm.
that you didn't think you were able to do.
Yeah.
Um, so I guess for yourself, can you think of moments where you feel like you've unlocked new levels of that kind of strength gain for yourself in that type
Oh,
of environment?
definitely. Oh, yeah.
What does that feel like?
You know, hell yeah. That's what it feels like. It's just like it's so exciting. I remember, from just when I used to squat, and what was actually interesting that you brought up is when I was at the MAC, majority of the men, they were encouraging. Like, "You got this, you got this." They
That's
would,
awesome.
everyone would kinda, like, stand around and "Alright, like, let's add a 2.5 to each side," or "Let's add a little bit more." And I think that just accomplishing, okay, even if it's 1 rep or even if you failed, you attempted, and having that encouragement from people around you that are like, like the fact that you tried is huge. Um,
Yeah, so how does that translate to other parts of your life? Because I ask a lot of people this question, but you have, you're a strong, successful woman. You do a lot of things in your life. You're managing this relationship. Like, how does this all translate in other parts of your life when you have those moments?
I think the biggest thing that I've gotten out of it is be comfortable being uncomfortable. in the sense of if you are comfortable in everything that you do, you're not gonna progress. You're not gonna move further, right? So don't be scared. Try it. You know, if you fail, it's okay. Get up and try again. And I think my journey is that is the one thing it has taught me. Going through medical school, becoming a doctor, it's not a traditional, route that I took. Going to school in the Caribbean, being a female physician, um, it's it's one of those things that the biggest motto is just keep going, keep doing it. You got this. And I think that's the biggest thing. Like, don't be scared, you know? If it was easy, everyone would be doing it, right?
Yeah, and your story's awesome, from Philadelphia to Atlanta, GA, to the
Mhm.
Caribbean,
Mhm. To
to
Brooklyn.
Brooklyn, to Kingston, to
So,
the Capital
yeah,
Region.
yeah.
So when you think about the rest of your life and your fitness and wellness goals, one of the things I often think about is your fitness journey's always just getting started.
Mhm.
So beyond just some of those big picture goals, you think about like healthy aging and who you want Shiv to be when you're in your 60s or
Mhm.
70s. What would your message be to Shiv 20, 30 years from now?
Consistency. Be consistent, Shiv. Don't give up. That would be my biggest thing. It's like seeing my parents in their 60s, 50s, 60s, um, getting started on their fitness journey, it was never a part of their routine, what we had talked about in the beginning. Going to the gym, working out was never a part of their day-to-day life. So that's the biggest thing that I want to tell myself, 40 years from now. Like, hey, stay consistent. This is a lifestyle. It's not like just a moment. Same thing I tell my patients. This isn't like a for now. This is something that you have to incorporate into your day-to-day life. Just like you have to eat, you have to stay active. This is good for your heart, good for your mental health, good for your well-being, good for the people around you, good for your energy. So that's the biggest thing that I have to tell people is or tell myself too, is like keep going and make a plan for yourself.
Well, Shiv, I can't thank you enough for sitting down with me.
Thank
And
you.
I opened by making the Michael Scott "I declare HIPAA" joke. I still declare HIPAA, but until our next visit, either in the gym or at the doctor's office, thanks for sitting down with me.
Thank you.